How does a person know if they're getting healthy, good sleep? Let's say I went to bed at 11 and I got up at 6, that was 7 hours. So how do I know if I've gotten good sleep?
Probably the best bet is how you function during the day, and do you feel the need to catch up on your sleep, say on weekends, for example. We have a lot of patients who get 5.5, 6 hours of sleep, but you ask them how much sleep do they really need to feel well rested, and they'll say 10, 12 hours of sleep. And what they're basing that on is their recovery sleep on the weekends. They're sleeping much longer on the weekends than during the week. And I bet you, and then we do this experimentally, if they would get 6 hours instead of 5, 7 versus 6, that little bit every day, they wouldn't feel the need to sleep 12 hours on a Saturday.
So in general, if you do studies and you put somebody to bed and you say, okay, you sleep until you wake up.
Yeah, we call this sleep extension. And we say, well, you need to get 20 minutes more, 30 minutes more every night. And oftentimes that by itself takes care of a lot of the bad sort of ill feelings that they get throughout the day, the lack of concentration, the moodiness.
So how does the person know? You know, it gets down to, they've got to say, well, I'm irritable, I'm cloudy, I don't think as well. What if the person can't visualize that? How does the doctor analyze that with his studies?
Yeah, well, we certainly can look at the sleep for problems, so medical problems that degrade the sleep quality. A sleep test environment is not your normal bedroom environment.
Yeah.
So sometimes it's difficult to know really what goes on in the patient's own home sleep environment based on what you see in your idealized setting. It's cool, it's dark, you don't have a bed partner who's snoring next to you, you don't have pets or kids in the bed with you. Oftentimes, those patients, their sleep, when you pull them out of that home situation, is perfect. They don't have a problem with their sleep. It's their environment that's the problem. And so that's what you can often see on your test.